Hey everyone, I'm going to be going live with Millie from Millie DPT. So let me just invite her and we are going to jump right in talking about. So let's wait for her to join. You know what's up. Hey everyone, thanks for joining. I'm just waiting for Millie. Gotta love Instagram. It's not her, it's just not being my friend. Hold on. I don't know why it's not working. I don't know, it's not working. I'm just trying to get Millie on here. Gotta love Instagram. Hold on. Oh wait, there we go. Millie is unable to join. Okay, let's try this again. Thanks everyone for your patience. Usually doesn't happen. It's not working.
Hey.
Oh my gosh. Hi. How are you?
I know Instagram's so funny. I like requested a couple times. It doesn't work.
I like 8 times. Anyway, here we are.
We made it.
How are you?
I'm good. Long day. Happy to be here.
Yes, same. In this moment, I'm grateful for under eye concealer and a ring light. Let's just put it
I got a pimple right before this. I like threw some makeup on.
Perfect. Okay, so we have a bunch of people joining, and I think that this is going to be a super hot topic.
Yes. Oh my gosh, so juicy. I really can't wait. There's so much to say, and we have to get it out.
There's a lot to say. There's really a lot to say. So before we jump into anything, also if I'm looking to the side, it's just because I have my notes over here. I'll just introduce myself for anyone joining from your side, and then I would love to have you introduce yourself. So, hi everyone, I'm Lauren Seidman. I am a childbirth educator, which means that I help expectant parents prepare for birth and life with baby, aka the postpartum period. I'm also a mom of 3, and really like the postpartum period is a huge passion topic for me because when I had my first child, who's now 6, I was completely shocked by the postpartum period, and that sort of like set me off onto this mission of learning more and talking to people about it. And then I got into this whole birth world. And so this is like really something that's close to my heart because as much as Instagram has normalized these things, I still hear too many people saying, no one told me, no one told me, no one told me. And that's really how I felt. So we're here to talk about it. Okay, Millie, over to you.
So hi, everyone who doesn't know me. My name is Millie. I'm a physical therapist, and I basically specialize in pelvic floor. So I treat a lot of different diagnoses, my favorite being post-pregnancy and postpartum. Those are like the 2 places that really have a soft spot in my heart, even before I ever experienced pregnancy and postpartum myself, it was just always an area where I knew that, you know, you're entering some new territory, somewhere you've never been before. There's a lot of fear of the unknown. So I love just being a resource and a support for, you know, new mommies along the way. And, you know, it's not only new moms, it's people that are new moms to their fifth or sixth kid. I have patients with 10 kids, God bless them, 11 kids, God bless them. And they come to me to basically help with the aftermath of that.
Right.
Yeah, and I'm a new mom. I'm a new mom. My kid's 9 months old. I'm also a personal trainer, like certified personal trainer. So I do work with a lot of pregnant women and women, you know, recovering after childbirth, trying to, you know, help them get stronger in a safe way. And that's me.
Amazing. Can you, before we talk about like anything postpartum specifically, can you give people listening like a basic definition, like what is the pelvic floor? Because I think a lot of people don't even necessarily know what that means. So can you help us just understand what the pelvic floor is, and then also just generally what sort of things happen to it during pregnancy and birth?
I wish I had my pelvic model with me. So your pelvic floor is basically a group of muscles located on the inside of the bones of your hip, right? So you have your two hip bones in the side, your sacrum in the back, and they basically run from the front to the back and side to side. They're kind of like a bowl or a hammock.
Okay.
And they have 5 main functions, which are sphincteric, so bowel and bladder control, sexual appreciation, support. So they support your 3 organs that women have: bladder, uterus, rectum.
Okay.
They're also involved in stability, so they're actually part of your core.
Yeah.
And everyone here is like, I want to have a strong core. Like, your pelvic floor is definitely part of your core. And they also aid in circulation and healthy tissue, just like any other part of the body where, you know, you get new blood, new oxygen, helps protect against injuries, which is very relevant to healing postpartum. What happens to the pelvic floor, you know, during childbirth? So first, during pregnancy, the baby's sitting on it, you know, sitting down on those muscles for a long time, especially towards the end, 3rd trimester, you know, things are getting pretty stretched out.
For sure.
And during a vaginal delivery, the muscles, the research, it's mind-boggling. The research shows that the muscles could stretch up to 250 times in length of what their normal resting tone is to push out the baby. And after a C-section, the pelvic floor is also affected because they're cutting you right, you know, right above the pubic bone, I guess. And the nerves that, you know, innervate the area where they cut are the same nerves that totally overlap with muscles of the pelvic floor. So I see a lot of C-section moms with pelvic floor dysfunction in the office as well.
Right. Wow. Okay. That's a really great summary. I think it's also, you brought up a lot of really important points, which I'm sure we'll get to later. One I definitely want to get back to is the relationship between the core and your pelvic floor, because I definitely always thought about the core as like its own thing, like just get a 6-pack, or when I was younger, before I was more mature, but you know, it was like just do sit-ups, get a 6-pack. And then also the point that you brought about C-section, you know, birthing by cesarean also having impacts to the pelvic floor. I think sometimes people think that just if you don't have a vaginal birth, then it doesn't affect your pelvic floor at all. But to your point, even just the fact of being pregnant and having that stress put on the pelvic floor, no matter what type of birth someone has, they still experience the pregnancy and the stress that's been put on their body. So amazing. Okay. So let's talk about the first few days and weeks postpartum. I just want to mention before I forget, if anyone has questions, instead of putting it in the chat, in the comments, if you could put it in like the little box with the question at the bottom, we'll definitely answer questions throughout and leave time for it at the end. I just find that sometimes when people put comments, like questions in the comments, it gets lost. If you forget, it's fine. But
we'll see it the whole time if it's in the little question mark.
Yeah. Okay. Amazing. So the first few days and weeks, it was a postpartum mom. So let's talk about that. Why don't you tackle the physical aspect, and then I'll talk a little bit about the emotional piece of it.
Okay. I'm going to talk about the physical, but there's a little emotional, like a drop that I'm just going to bring up. So the first few days postpartum, very normal to feel like a truck just hit you. Like, I remember those words coming right out of my mouth. And I'm going to get a little personal here.
How can you not? Like when you talk about these things, it's like impossible to take like personal experience, especially when your baby is less than 1 year and it's your first baby. So go for it.
So I don't even know where to start. Okay, so let's start with like right after giving birth, right? So like you're on that little, sometimes, okay, here's something. It's normal. Sometimes you're gonna want to hold your baby, sometimes you're not. You might feel tired, you might feel not, you know? So a lot of people ask me, like, when can I start doing pelvic floor exercises? You could start in the hospital bed. Like I remember the night after giving birth, like starting my breathing and starting, you know, doing some light pelvic floor contractions. Wow. I was just like, I want to heal. Like I want to be in touch with my body. It was coming from such a place of love. Like I just birthed the baby, and you know, just like any other part of my body needs circulation, my pelvic floor needs circulation. Usually the protocol in most hospitals is that the nurse has to help you go to the bathroom for the first 2 times. Yeah. So, you know, sometimes you might lose, you know, a little bit of sensation of having to go to the bathroom. If it happens in the hospital, I wouldn't, you know, red flag it, but definitely, you know, keep track of it, monitor that.
Meaning if that's like an ongoing issue that someone's having, then that might be a red flag for them.
Sometimes if you had an epidural,
an epidural can,
you know, it's like a few hours later,
right?
You know, you might pee yourself, but that might not necessarily be pelvic floor dysfunction,
right?
So you know, I remember the shock of having the nurse make me an adult diaper, basically, out of hospital underwear, maxi pad, ice. She gave me like something like that? Yeah, I mean, no, mine was different. Mine was like mesh.
Mommy pad. No, this is not the underwear.
That's a pad. I thought that was the actual diaper. Okay, mine was not that big, but I remember just being traumatized, and I was like, everyone does this? Yes, everyone does it.
It's crazy.
Every single woman that has a vaginal birth does it. You have to take care of yourself. You always want to keep, I actually have a lot of notes on this. You want to keep the area as clean as possible. So no toilet paper. You're always going to spray with that bottle. I say at least 3 to 4 weeks minimum.
For sure.
You don't want to use toilet paper. Definitely use the Dermaplast spray they give you that numbs you. Another thing that's important is, I think it's important. Doctors don't always tell you what degree you tore. They don't want to scare you, but I think it's important.
Okay, wait, stop. I'm going to stop you for a second.
Yeah.
There's a lot to say.
There's too much to
unpack. So far what we said is, physically speaking, right? You've gone through this massive event of giving birth. Your body's taken a hit. You say you felt like you got hit by a truck. I totally agree with that. And I use the same language. Also, like I just want to reflect on the experience of you saying like someone needs to help you go to the bathroom. Like, it's like kind of shocking. Like you've probably never had that in your life, and you're like, well, I just gave a baby and I can't even go to the bathroom on my own. So I think just acknowledging that is like a super temporary situation, and if if that is continuing, okay, so that's a red flag for something going on with your pelvic floor, but it's just temporary. And then you also brought up like the mesh underwear, the large sanitary napkins that you'll be using because of the heavy bleeding that happens after the birth. And that's true, by the way, just for a vaginal birth or a cesarean. I just want to clarify that, because I was clueless about that part. I thought if you had a vaginal birth, you're bleeding, but if you have a cesarean, like maybe you don't. But now obviously it makes no sense because it's your uterus shedding the lining.
It's contraction, yeah.
But then, so you brought up that. And then obviously in terms of postpartum recovery, keeping everything clean, using the peri bottle, Dermaplast spray could help numb the area. I also want to add in using a sitz bath. Like they'll give you like that little basin in the hospital. You can take it home. I tell all my students, like, take everything you possibly can. If anyone here is about to have a baby and whatever supplies they're giving you in the hospital, just take it home.
I always tell my patients, steal everything. Just
steal everything.
Just take it. Just
take it all. Take the peri bottle, take the sanitary napkins, take the nursing pads, take the sitz bath. What else did I give? The Dermaplast spray, if that's something that you like. Yeah. There's all these things. And then you mentioned about tearing. So tearing, just to clarify from a birth education standpoint, tearing is something that can happen during the pushing stage, when the vaginal wall is stretching. So it can happen in your perineum or in the vaginal wall. And that can really affect how you feel in terms of the recovery. Someone who has no tearing, they're still going to feel sore and still may feel like they got hit by a truck because a lot just happens. But
and don't forget to stitch you up. For those that don't know, they do give you stitches that dissolve.
Right. So depend, yeah, exactly. And this, if you have stitches, then it also can just add to the discomfort, especially while going to the bathroom. So there's a lot going on. And
so for that, I actually recommend you could use the bottle while you're urinating.
Yeah, that's definitely what you should do, for sure.
Yeah,
100%.
Yeah, totally. After, like during.
Yeah, totally great to like help with the burning. I also remember like after I had my first, just being like, what in the world just happened to my body? Like, is this ever going to go back to normal? And someone actually asked the question about that in my stories, like when do I go back to normal?
Yeah, it's a good question. You want me to answer that?
I don't have an answer. If anyone's
so I have like an answer, but it's not an answer. This is my answer. A lot of it has to do with genetics. That's like number one. Okay. This bounce back culture, I don't even know what it means. What does it mean to bounce back? What does it mean? Does that mean like in a year? Does that mean in 6 weeks by the time you go to your checkup? Like, I don't even know what that means. Everyone's different. Everyone heals at their own rate. You just birthed a human. You have a wound the size of a dinner plate on the inside of your uterus.
Totally.
Okay. There's a lot going on. Your hormones are going crazy. If you're nursing, your hormones are still going crazy. A lot of what I see is I'll have someone who's, let's say, 3-4 months postpartum, you know, maybe they're nursing, maybe they're not, but they're like, I still look like I'm pregnant. I'll check them for a diastasis, which is an abdominal separation that could give off a look of like a little poochy stomach. So that is something that could be worked on with a qualified physical therapist or personal trainer.
Yeah.
Another concern that a lot of women have is they'll say, you know, I'm back to my postpartum weight, but I just look so different.
Right.
And I just wanted to explain a little bit about why that happens.
Yeah. So go for it.
So like there's a number on a scale, which is just the effect that gravity has on you, and that's the number that you get in the scale.
I love that explanation.
You have no idea what that actually is made up of. Take into consideration when you're holding a baby, your ribs expanded, your pelvis expanded, right? Your whole body has widened to make room. You held on to a lot of fluid. You have more breast tissue. You have more adipose tissue. Your hormones are at different levels, storing more fat than it might be used to doing at a normal time. So you also have stretched out skin. So there's so many different factors that could be leading into the reason why you may look different. Maybe you have less muscle.
Right. So in terms of like fat. When we talk about postpartum recovery, I think that could mean a lot of different things for different people. So there's obviously like that baseline of, okay, your bleeding is stopped. If you had any stitches, those are healed. If you had a cesarean, that incision is healing. So that's that baseline. And I think the title of this live is postpartum is not 6 weeks. So if you have this like 6-week line in the sand where you go to your provider and they're like, okay, you're healed. But what you're getting to is like, there's a lot more past that. And obviously there's an emotional and social component, but there's also this physical component that you're alluding to, which your body just changed. So aside from like your weight on a scale, like, which I think we probably both agree is not a great measure of how you're doing.
Yeah.
Because that has absolutely nothing to do with how you're doing as like a mom or even in terms of your recovery. But if we're talking about anything. It doesn't mean anything. If we're talking about actual like full holistic well-rounded recovery, my pelvic floor has a proper tone, like as a pelvic floor physical therapist, what types of measures I guess do you use to assess how someone is actually doing in terms of their postpartum recovery? Like
that's a great question. I'm going to start out with some data, hard science facts.
Okay.
Science shows, these are numbers from studies. You can ask me for them later.
Okay, great.
Vagina, muscles, uterus, 9 months to recover. Abdominal wall that gets stretched out like humongous to make room for a baby, 18 months, okay? 18 months. So if you're asking me why you still have a little pooch, 18 months. And if you're not consistently working at it, you gotta work. Like you have to work for it if you want it to go and look pretty toned, but you still have extra skin on you. Like it's not, you're going to have a new normal to some extent, unless you're like really blessed with really good genetics, which I see a lot. I do see that happen a lot, don't get me wrong, but if you don't have the genetics,
Yeah.
then you have to either work really hard or just learn to love a slightly different body.
100%. I really, yeah, it's such a great point around how do we feel about like going back to normal. And my personal view is like similar to what you're saying, is you sort of like, we have to think about it as we're a new normal. And actually I have a blog post about this on my website because I feel very strongly about this. Like, I don't believe in the term bouncing back. Like, once you're, maybe you could appreciate this also because like now you're a mom and you're like in this whole new phase of life. Like, what about that notion of bouncing back is actually like serving us? Like, why do I want to go back to what?
Right.
What? My like pre-baby life.
It's what you're used to.
Like,
it's what you're used
to. You're comfortable like with that. And like, yes, there are times when people miss their, myself included, miss their like pre-kid life, but like we're moving, you know, you're moving forward. So I think this whole idea of like bouncing back, it's not like, what is that doing? You know, like it's just it's just frustrating.
It's
Whereas
just, it's just impossible for most women too.
It's impossible. You're not gonna get your body.
You'll never be happy.
You're not gonna be happy. It's frustrating. Exactly. Like, your body has changed and it is going to be permanently changed forever. But what you're saying,
Millie, is that fantastic.
What?
You could still look fantastic with your new hips. What
you're saying is there's still things you can do to re-strengthen and regain tone if that's something that's a goal of yours. So what I want to hear is like, what are the actual like health measures, like from a health standpoint? I'm not talking about like superficial, like looking like a hot mom. I'm talking about like from a health standpoint, what are some of the things that people should be looking for? And then also, if you want to say like, what are some of maybe the red flags for things that people that could come up for people and they should seek some help. Yeah.
So I get it. I get patients sometimes coming to me for what they, you know, what I would call like a postpartum checkup. They had a baby within the past few months and they would just want to see what they're doing. They also sometimes want to go back to exercise and they want to make sure that they can do that safely. So a lot of what I measure is when I'm doing the exam, which I'll explain in a minute, I want to know, are you able to overcome the tasks that you need to do? So whether it's taking care of your kid, and exercising, I want to see if you're able to withstand that.
Okay.
So when I do a pelvic floor exam, or really an overall exam, I'm looking at your hips. How strong are your hips? How are they moving? I'm looking at your core. How do you engage it? Are you compensating using other muscles because your core is not strong enough to handle the load? How are you breathing? Are you hyperventilating into your chest, or are you able to take a deep breath into your back, into your ribs, into your belly, which tells me a lot about your coordination. And if you're ready to go back to doing exercise or even picking up a 16-pound baby off the floor, you know. When I do, you know, more of like an internal exam, I'm looking to see if the muscles are coordinating with your breath. I want to see if they could coordinate. I'll ask the patient to do a few different things. I'll have them cough, you know, contract, relax, bear down. And I want to see if they're able to do what they need to do. If someone is a softball pitcher and, you know, their shoulder is not working the right way, I'm not going to tell them to go play in a game, right? It's the same exact thing. Like, you need to have the muscles and the function, the coordination, the range of motion, the strength. And it all needs to work together, right? You're not just the pelvic floor. Like, you're an entire person. So I'm looking at your whole life. And by the way, aside from that, we talk about nutrition, we talk about sleep. Do you have a support system? If you want to exercise, can you? Do you have someone to watch your baby? So I'm taking everything into consideration, and we really try to come up with a plan, you know, at the first meeting, like, how are we getting you to where you want to be?
Wow, I love that. And so how soon can someone actually start, or what are the prerequisites to someone getting into like more of a lot of people wrote in questions about working out. So if someone wants to run or work out, what are some of the prerequisites to getting there? I love the analogy of a softball player, and I think that really applies. So what are some of the prerequisites to someone getting back into movement, and maybe share some tips about how they can do that like responsibly? safely.
My number one tip is always going to be work with someone that's qualified. There's a lot of people out there that say they're like prenatal or postpartum trainers. You really should look into what courses they took and make sure they know their stuff and they're not just going based off experience, because it is an art. It is an art to gradually build someone up safely at their level to where they want to be. So a lot of girls will tell me, oh, I had a baby, I'm this many weeks postpartum, I want to go for a run. Stop right there. Stop right there. Running is something you have to work towards and train for. It's not something that you're going to get into right away, right? So the first 5-6 weeks of giving birth, you want to work on reconnecting with your core, doing breathing exercises, getting in touch with where your muscles are, because if you're not coordinating correctly and you're, let's say, bearing down too much or holding your breath, you could actually damage, you know, your abdominal wall or your pelvic floor. So you want to make sure you're doing all of that correctly. That's number one. That's number one. I can't get into too much detail because I'll be here all night. But then, you know, when it comes to running, I actually have a video on my feed called Postpartum Back to Running Assessment. And the minimum amount of time is 12 weeks. It could really be up to 6 months that you'll go back to running. Or anything with a jumping or high impact. You want to do jumping jacks, burpees, like anything where both feet are leaving the ground at the same time. You really want to train for that. So basically, I recommend doing this assessment at 10 weeks just to see like where you're holding, like where you are. And you could go on my page, you could look through the moves. It's a bunch of single leg moves that mimic things you would need to be able to do in order to go for a run or jump, right? So, you know, jumping on one leg, jumping from side to side, standing on one leg, how's your balance? Are your hips dropping? Are your knees caving in? Are your ankles rolling in? And you want to make sure you train yourself to be able to do all the moves. And this is a research, you know, this is an evidence-based protocol. You want to make sure you could do all of the moves in order to return to anything that is high impact. So running is not something you do to lose the baby weight. It's something you like work towards, and it's a really great goal to have. But you just have to be patient, because if you want to run, then that means you're going to put a lot of work in before building up your back strength, your glute strength, your core strength, your pelvic floor strength to be able to withstand the bounce, right? Every time your leg hits the floor, you're taking in so much impact.
Wow. I think that's such an important point for people to hear. A couple of people wrote in. Let me just check the questions. So someone wrote in, 4 weeks postpartum, already working out. What are your thoughts? Okay, so there we go. Should I stop running? So someone said, I'm, you know, newly postpartum. I've been running for a week. Should I stop running? I feel totally fine. So what do you say to that? Like, if someone feels fine.
Okay, so it's a great question.
Right.
This is like a long-term savings account. Right? You could feel fine now, and that's really fantastic. I'm happy for you that you feel so good after having a baby. Congratulations, you rock. That's number one. But this is a long-term event, okay? Like your body is going to change over the next however many years. Like, let's say you're not done having kids and you want to have more, and then later on you're going to hit menopause, God willing, like at a ripe age. Your body's going to go through so much. You want to save up as much health from now as you can. So even though you feel great, I would recommend scaling it back. You could do workouts that make you sweat and drip and feel really good at the end. You know,
endorphins,
you know, early on, but you just have to do it gradually. So I would stick to something that's more low impact. I would be doing a lot of core exercises, making sure you're not doming or coning. So that means making sure your abdomen looks flat when you engage your core and doesn't like loaf up while you're moving. You want to make sure you're not experiencing any pain or leaking. But I would definitely scale it back, and you could totally build yourself up. You just have to do it gradually for the long term. It's very tempting, and this is like any injury that I'll have. Like I had someone who tore his one of his calf muscles, and he wanted to go back to running, and he was like, but I feel so good, I just want to go back to running. And I said, this window of time that you're in right now is your make or break, right? You feel good, but you're still injured, so you can't go back. You can't go back yet, because you're still healing. So even though you know you feel good and you're not perceiving any pain, it's not the time yet. You still need another couple weeks to heal. So same to someone who just gave birth and feels fantastic. That's really amazing. Like you're really very blessed because not everyone has it that easy. They're all in my office, those people. So just scale it back and build yourself up gradually, and you'll thank yourself in the long run.
Right. I sort of imagine it in my head as like pregnancy and birth, like in terms of your pelvic floor strength, they sort of like weaken it, like stretch it out, like mush it kind of. And then what you're saying, what I'm imagining in my head as you're saying this is you have to like re-strengthen, build it up again. And then once you're at a certain level, then you could add on the more high impact. But if you add on that high impact when you're like still here,
exactly,
like it might be okay for the time being, but in the long term, it could come back to bite you.
Yeah.
What would you say to someone? Yeah. Sorry, say that again.
No, I'm just saying you might be working on a non-solid foundation.
Right. What would you say to someone who's like, I know I want to have more kids, and I just don't feel like it's worth it between kids to re-strengthen my pelvic floor because, or like if they have diastasis, like
I love this.
I'm not going to correct it because it's just going to get worse with each kid, and you know, there's no point. I'll just wait till I'm done having kids to work it out. By the way, this is based on conversations I've had with people, and
I love this.
Some people have gotten this advice from other providers who might not be as knowledgeable about the pelvic floor and how it works. So what would you say to that?
That's like saying, like, I'm going to do a marathon. I'm just going to, like, relate things to, like, you know, non-pregnancy just to make it more digestible. I'm a runner, right? So it's like saying, like, I'm going to do so many half marathons and I'm never going to qualify for the Olympics. So why should I even train? Maybe when I'm 40, I'll want to train for the Olympics. So I'll just train when I'm 40, right? You're going to do all these races and they're going to stink. You're not going to do well. So not to say your pregnancies aren't going to be good, but your pregnancy could be so much better. Your delivery and recovery could be so much better. If you strengthen yourself, you'll have so much more energy to take care of your kids. You'll feel better about yourself. You'll just have a much better foundation to work off of. And yes, that is correct. If you don't do anything, it will get worse from kid to kid to kid to kid. But you could play catch up and feel good about yourself and take care of yourself and be a better parent because you're taking care of your health, strengthening your muscles, being able to lift your kids without having back pain.
Right.
Another thing I want to say is that, you know, it's very normal to gain anywhere between, you know, I'm just giving a rough estimate, 25 to 45 pounds, you know, during pregnancy. And if you are, you know, this rollover, right? Like if you are 5 pounds more than you were last time, okay, that's fine. But then, you know, you might gain the same amount and then the next kid and the next kid, and you keep adding those 5 pounds on. You're just going to have more catch up to do at the end. So you just got to maintain what you can and do your best to strengthen yourself so that, you know, your kids are only getting bigger and heavier. You're going to need to lift them up. You got to lift strollers in and out of the car.
For sure.
It's never going to end. You always have to be functional.
Yes, exactly. No, that's such a great point. Like the day to day, it's only going to help you if you are able to rehab a little bit at a time. So you're waiting till the end.
Your subsequent pregnancies, like they'll feel different. People that have had pregnancies where it didn't work out and then ones that they did will tell me it's a whole different ball game, and the delivery was 1, 2, 3, like, you know, the recovery is much smoother. I can say from experience, I was the best patient ever, and I usually don't take my own advice. My pregnancy was very hard, but I worked out a lot. You know, it was hard emotionally. Physically, it was pretty much okay for the most part. But my recovery, I was sitting like crisscross applesauce on the floor 2 or 3 days postpartum. Like I was chilling. Like I was really, really chilling, and I did not jump back into exercise. I was very gradual. I did not go running till 5, 6 months. Like I really just took it easy, even though I felt good. But I felt so good after. And could I say 100%, oh, it's because I did all these things? I can't tell you for sure, but I could definitely tell you that it helped. It definitely helped.
Yeah, for sure. And even like when it comes to the birth, like when you're pushing, you're not using, like when we're talking about the pushing phase, you're not using your face to push.
You're not using your pelvic floor to push. You're actually not. You're not using your pelvic floor. Your uterus is contracting. You're like directing the energy to where you're directing the pressure to where you want it to go. You're more using like your abs and your breath. Right. And your ribs. Like, it's a very big misconception. You actually want your pelvic floor to be relaxed and out of the way so that it's not clenching.
For sure. So I'm saying, like, when it comes to the birth, like having a well-toned pelvic floor is
Yep,
going
coordination.
to be of your benefit, right? That's my understanding.
You want a lot of coordination. I work on a lot of that
Yeah.
with my very pregnant patients. We do a lot of birth prep, and we work on how to coordinate the pelvic floor with pushing.
Love that.
Mm-hmm.
Yeah, amazing. I mean, it's like totally an unknown, whatever, just an unknown fact that those
No one
things
talks
are all
about
related.
it.
And so no one talks about it. There you go. That's why we're here. So we spoke about working during pregnancy to strengthen the pelvic floor, and then also in the postpartum period between kids. Is there anything else you wanted to add, I guess, on like red flags or some like common issues that people have?
I mean, I could just talk about common issues and why you should see a pelvic floor PT.
Great.
So urinary leakage right away after giving birth. I'm not talking about in the hospital. I'm talking about once you get home. That's definitely a sign you should see a pelvic floor physical therapist. Diastasis for sure if you have a concern about diastasis.
Can you define what that is for someone who might not be familiar?
Diastasis.
But what is it?
Sure. Basically, we have 4 layers of abdominal muscles, one of them being the rectus abdominis. That's the one that, we call the 6-pack. There's a tissue that runs down the middle of it that during pregnancy, it kind of weakens and separates to make room for the baby. And after you give birth, anywhere between 3 weeks and 3 months, it usually heals on its own. For some women, it does not heal on its own, and you just need to do a little bit of extra work to kind of get it to where you want it to be. Sometimes it's a functional diastasis, so that just means that it's separated, but it's not really affecting your life in any way. But it is a reason to go see a physical therapist just to make sure it's not causing any issues. So that's that. There's also like bowel symptoms you can have, leaking gas, leaking feces. You could come see us for that. And then dyspareunia, which is just the medical term for painful intercourse. If it hurts more than 3 times.
Oh, you went on mute.
Sorry, I got the low power mode warning.
Oh.
If it hurts more than 3 times after having a baby, there's my father. I would say then come make an appointment.
Good timing. Okay, those are some really important warning signs. And I actually had an interaction with someone that's a client of mine, and she asked me about what you said about leaking gas. And like, do you know anything about this? I said, I mean, from what I know, generally high level about the pelvic floor, it sounds like a pelvic floor issue.
Yeah, of course. Yeah.
And I think you should see a pelvic floor specialist for that.
Yeah, you could definitely come to us.
So I'm so glad you just said that, because that was, I feel like
I see it all the time.
Like the right advice. But that's also like all these things, Millie, that you just mentioned, like people don't want to talk about these things.
I could talk about it all day.
You can, and I think that's incredible, and I'm so glad you're here, like normalizing it. And I also, like in my classes, I always mention if you're having, pain with intercourse, leaking urine, and if anything, just also generally, if anything feels off, like you don't have to live like that, right? Like your body, and these examples that you're giving specifically, like it's just important for people to hear, okay, there is support out there. Like your body just went through this huge event of being pregnant and having a baby. And it doesn't mean like, okay, well, I'm a mom now, so my body's just like.
It's not like a part of it,
It's not a part of it. Exactly. My body's
not like a part of it.
It's done now. Like, I'm just going to give up. Like, no, like there are things that you can do. It's just when people don't want to talk about, like I leaked gas. Like no one's going to say that, but for anyone out there who's listening to just hear that these things, there is actually help for them. There is something you can do. Yeah, go ahead.
Yeah. I ran into a few old friends and they were young. Maybe they're on here. Hi guys, you might know the story, but they were just telling me like, oh my gosh, I'm having pelvic floor symptoms. I need to come see you. And they're like in their young 20s. And I said, yeah, come see me. Like you should be living your best life.
Exactly.
Like you should not have anything holding 100%. You back from anything. It's 100%. Just knowing that this service is available could be so liberating,
So liberating. And I think the like big companies out there with marketing around, especially with like urinary incontinence, like, oh, like a sanitary napkin, like just wear that. It's fine that you're leaking pee.
Bacteria, that's a jungle.
I'm just like, what? Like, how is this being accepted? Okay, so let me just scroll back to see Okay. Yeah, someone just saying, when I gave birth, I felt so good and I felt like I could run and jump and do a lot of housework and other things, but then surprise, my uterus prolapsed. Let's talk about prolapse. It's very important to give your body time to heal. And there was also a question here around prolapse. Wait, let me just ask that and then I want to talk about that.
Yeah, let's talk about prolapse. I love prolapse. Like I love treating it.
How do you distinguish between normal pelvic pressure and actual prolapse? Does weight gain during pregnancy increase pelvic problems? Okay, that's kind of a little bit of a separate question, but in terms of prolapse, can you define what that is? And then also, how does someone know that they might have it?
Yeah, definitely. Okay, so we spoke about how the pelvic floor supports the bladder, uterus, and rectum inside, right? So what could happen after pregnancy and delivery is that there's ligaments holding, there's the muscles holding everything up, and there's also ligaments holding up the organs. What could happen is they could weaken. And so what we'll see on an exam is if we ask a patient to bear down, we'll see any of those three organs kind of exiting the canal. So it's kind of like it's not as bad as it sounds, but they're kind of like falling out of you. Like one of the questions I ask in an evaluation is, do you feel like something is falling out of your vagina? If the answer is yes, then I'm going to go check to see if they have a prolapse. And you could also have a rectal prolapse, so it could actually come out of your rectum. And there's a lot of different types, and it's a whole big topic, but that's basically, in very short, what prolapse is. It's a pressure management problem sometimes, and sometimes we just need to teach a patient how to manage it, meaning once you have it, like you kind of just have it, like it's not really going to go back, but you could live the most fulfilling, full life, not being held back from anything with it, as long as you know how to manage it and you have the tools and you know how to use your body and body mechanics to make it work for you. Sometimes I recommend pessaries, which is basically like a sports bra for your organs, and it kind of like just holds everything up. It's not like a brace, like you're cheating anything out of anything. It's kind of like a sports bra holding your organs up where they need to be. But we do a lot of strengthening. We do a lot of body mechanic work, teaching you how to do things without putting pressure down. Because things like excessive pushing, bearing down, like having a bowel movement, that could definitely, help cause prolapse. And that's a lot of the reason why I say to slow down exercising. You don't want to give yourself a prolapse.
Okay, so there's another reason to not rush back into things, because you might feel really good in the moment, but you can actually cause yourself some other issues.
Long-term investment. You have one body.
Totally. Do you see in your practice people that had, in terms of the birth, like someone that pushed for a longer period of time, I guess that's like the first example that comes to mind. Like, so in terms of how someone's birth went, does it increase their chances of having a prolapse or pelvic floor disorders, or yeah?
There's a study.
Not sure.
So from experience, I never really parsed it out, but I did read a study. It was very interesting. I don't remember the exact numbers. I'll give you like an approximate. The conclusion was that women that pushed, I think it was in less than 30 minutes and more than 2 hours. I'm not 100% sure of the numbers, but it's something along those lines. People that push out more quickly, under 30 minutes, and people that push for more than 2 hours were more likely, and I don't remember that percentage at all, but they were more likely to have a prolapse. And that was because if you push too quickly, it might have been too much pressure down on the muscles all at once. And then if you're pushing for more than 2 hours, then you're pushing for a very long time, stressing out those muscles and ligaments for a long time. And I'm just going to answer quickly. Someone asked, what are the symptoms of prolapse? Mainly, it's going to feel like pelvic pressure coming down, and it's also going to feel like something's kind of falling out of your vagina. Like it feels like something's falling out. That's how my patients describe it.
Yeah. Okay. Great. Yeah. That is great. Because the question that I had was, how do you distinguish between normal pelvic pressure? And I guess the answer to that question is like, there is normal pelvic pressure, but you probably shouldn't feel much. If you're feeling pressure, then what I'm understanding from what you said is that could be a sign of a possible prolapse.
It could be. Sometimes pelvic pressure. Sometimes people come to me with pelvic pressure postpartum, and I check them for prolapse, and I'll just find like super tight muscles, super tight hips. It could be a few things.
Could be something else. Okay. All right, let's see what other questions we have. Okay, this is a good one. Millie, I know you're going to like this one. Nursing wrecks my libido. Sorry if it's TMI. Am I the only one? Okay, so
I love this topic.
First of all, no, you're not the only one.
Yeah.
So do you want to take this, or do you want me to start?
I could add. Yeah, I could definitely speak to it.
Okay.
So your hormones are fluctuating after birth, and then even more so if you're nursing, right? When you're lactating, your body, I'm not going to get too sciencey and lose you, but when you're lactating, your muscles, your hormones need to be in a certain place to produce the milk.
Right.
So there's a whole domino effect that needs to happen through your hormones. And, your body's in a state of, I need to keep a baby alive. And it's not thinking so much of, I need to reproduce right now. So you might not be willing, in the mood as much.
Yeah.
You could definitely talk to someone about that that's licensed, like a sex therapist, I don't know.
Right.
But, you could always plan, having fun. You don't have to always be in the mood. You could plan it, and it's emotional too. It's not only physical.
Right.
So
yeah,
that's what I have to say.
No, that's a great point, and I like what you said about your body's not thinking about having another baby. It's just thinking about keeping the one that you have fed. But yes, it's such a great point. I'll just add on, like, with the hormones, the hormones that help your body produce milk suppress the hormones that would increase your sex drive, basically. And so there's definitely this hormonal aspect, but I also just would want to add, there's a lot of demands that come on your time when you're a new mommy, and a lot of being touched, and a lot of times people feel what's called touched out. Official term, but you feel touched out, like your baby, whether you're nursing or not, you're holding your baby and feeding them. Maybe you're nursing, changing diapers. There's so much touch, and it's and if you even have more than one child, your toddler is climbing on you, and you have a baby also. You're just at the end of the day, you don't want to be touched anymore. And I think we can't also underestimate yes, we can blame it on hormones, but if you want to be nursing for a long period of time, you have to figure something out. You can't just go without that relationship for a year, let's say.
It's funny, and so you could also, it could be different. I don't know, boobs are off limits. Okay, you could make it work. You can make work. That's the only thing that's off limits, and then everything else you could.
Right. So I was gonna say there's a lot of logistics also going on when you become a new mommy. So yes, the hormones have a for sure physiologic role to play in this.
You're also tired. You're tired. Sleep deprived.
Exactly.
You might not. The baby might be screaming. When are you even gonna have time to do anything for yourself?
Right. So exactly. So figuring out if there are things in your life that could help you feel more like a person, and that could help you be more in the mood, that are things within your control. You can't necessarily control your hormones, but you can control, okay, maybe I'm going to get a babysitter for an hour. I'm going to let grandma watch my baby for an hour so I can rest and take a shower and put on clean clothing before my husband gets home. So that way, when I see him, I'm in a better mood and not ready to just throw the baby at him and be
I can say I recommend it to a lot of patients, planning and not always being so spontaneous.
Yep.
The reason I have to do that as a clinician is because if someone's having pain, right, I'm going to give them what to do to prepare themselves before so that it's less painful, and it ends up being a much better experience. So same thing if your libido's down and you're feeling logistically it's so hard and you have to jump through so many hoops, plan it. Just plan it. It might not be like the olden days, but it's not going to happen if it's not going to happen.
It's so true. I just watched another live about this, about low libido in general, with Bracha Bardwinter and
I love her.
Batsheva.
I love her. Okay, cool.
And they did a great live on low libido in general, and they talked a lot about planning, and it's part of it. And when you're a new mom, that is just part of your reality, and it's not bad or good. It's just, it is what it is. And this, I think someone saying I have low libido is recognizing that they would like their libido to be higher, and so this is a possible solution that you can use to help you with that.
You just get the engine going.
Yeah, exactly. So with nursing, yes, there is this hormonal aspect, but I think it's also worth mentioning about the logistics of life as a new mom and what you can do to try to navigate that. Okay. Should everyone go for a PT consult post-pregnancy or only if there are issues?
I love that question.
Such a good question. Okay, what do you think?
Okay, there's like two different answers. There's like if insurance companies didn't exist, and then like if they didn't,
right.
You know what I mean?
Right.
But I'm not even sure how to answer this one.
Let's say very
biased. I know what it could do for you. So I've had people come to me say, I want to go back to exercise and I don't know if I'm doing things correctly. I love that. I love that so much. You're like super educated if you do that, and you're like my favorite patient. I will check to, see if you have what it takes to go back to doing what you need to do, teaching you how to start from the bottom up, giving you the skills to progress yourself once you're done seeing me. Mm-hmm. If you're not having any symptoms and you're not really rushing to get back to exercise, I would say that you will definitely benefit from going. You might not be working on, on specific pelvic floor things because you just might have to strengthen yourself if you're a little bit weak, which you most likely are. So therapists will teach you how to strengthen yourself and engage your core better, and will also help you with postural things, breastfeeding, hunching over, always carrying a baby to the side. There's a lot of orthopedic ailments that come that people that specialize in, women's health, physical therapy, we're not only looking at the pelvic floor, we're looking at you as a mom. So there's a lot of other things we could help you with. I want to make a video, I've been talking about it for a while, just about like how to lift up a doona and put it in the car. Because I'm watching everyone break their backs overdoing it. Yeah. Like when you're a mom, you're leaning over a bed, you're leaning over a crib, a changing table. Like there's so many other things that you could work on. And everyone I speak to has some sort of back, shoulder, hip, chest tightness, pain, this, that. So everyone can benefit from it. I think if you're having symptoms, like 100%, you should go. You're doing yourself a disservice if you don't. That's my answer.
Okay, that's helpful. If someone wants to do like, let's say a self-assessment, or they want to get one of these like online programs, I know you mentioned before, make sure you're doing it with someone who's legit. What are some things that someone should look for to make sure they're getting information from a reliable source? Okay,
love that. I feel comfortable recommending two programs right now that are available online. There's an account called Expecting and Empowered, and they have a pregnancy and postpartum program you could buy. I actually purchased it and used it during my pregnancy and postpartum period. I'm not a good patient to myself. I can only follow someone else's instructions, even though I know exactly what to do. Like I can only do it if someone else tells me. So from my personal experience and from a clinical point of view, I thought that program was like super, super duper well put together. So it's called Expecting and Empowered. And then there's another one there that it's like a very different style. It's called Get Mom Strong. And what's interesting is that so Expecting and Empowered is actually written by a women's health pelvic floor physical therapist. Get Mom Strong is written by, I don't even know what her qualifications are, but she seems to know what she's doing. So she's like some sort of trainer that specializes in perinatal fitness. But what I would look for in general is what courses has this person taken. Some really good names that, would look good is if they took the Sarah Duvall course, if they took anything by Herman and Wallace, anything by the APTA having to do with, pelvic floor perinatal health. I think those are like the three main ones that you should be looking for. But just because someone has worked with pregnant women in the past doesn't mean they know what they're doing.
Okay. I think that's really important because there's so much out there, and it's sometimes hard to, especially for someone who's not as knowledgeable as you are.
You should be an educated consumer.
It's good. It's really good info. Okay, let's see what other questions we have here. Can you please save this live? Yes, the live will be saved. Okay, 3.5 weeks postpartum. Is it a bad idea to go for a bike ride?
Congratulations, first of all. Biking. Ooh, biking is a good question. I would start after the 6-week checkup. I mean, nothing's going to happen to you between now and then. I would take it easy, let yourself rest. You're still probably most likely bleeding. I would take it easy. Go for walks. Definitely. Oh, that's like a big one, by the way. Starting from the week you give birth, you could totally go walking, starting with 5 minutes and like slowly building your way up. You could go for walks. And you could even like power walk for 60 seconds at a time and build it up to like 5 minutes at a time
Yeah.
once you feel comfortable with it and get that
Yeah.
sweat on, get that
Yeah.
endorphins going. I would
Totally.
wait till your checkup to go for a bike ride. We should talk about the 6-week
I know.
checkup.
So
We
let's
didn't
talk
even
about the
talk about
6-week checkup. I just kind of make a comment on what you said about walking. I think that's such a good tip for people. Like, start it for 5 minutes at a time. I speaking from my own personal experience and also just from working with people that are having their babies, I'm in touch with them after the birth. Like, my own personal experience, I definitely overdid it after a couple of my kids. My third baby was a COVID baby, so I wasn't leaving the house. But my first two, like, after, I would notice, like, if I overdid it, meaning if I walked a little bit too far, we were living in the city at the time. I remember walking like 5 blocks a few days postpartum, and my butt, it hurt after. And I had a great birth, you know? So I just feel like being honest with yourself and like, okay, sometimes you might overdo it, but like trying to release that pressure, like pressure that we all put on ourselves. Like, I just want to get back. I just want to be able to walk. I just want to be able to what I'm doing. I just want to be able to host for Shabbos. I just want to be able to like clean my apartment. Like, no, like take a step back. Honor what you just did. You just gave birth to a baby. Take it 5 minutes at a time for your own mental health and social well-being, not because you're trying to like, you know, get fit like ASAP. So the point around like 3.5 weeks postpartum, wanting to go for a bike ride sounds really amazing, but like to your point, maybe it's not really the time and waiting for the 6 week. Okay, so what actually would someone get from the 6-week checkup from their OB, presumably?
Yeah, so 6-week checkup is where your doctor is looking at tissue healing. They're looking at, I actually don't know like 1,000%, you know, they're doing a cervical exam. They're looking and they want to
okay, are you
see
healed? So your
where the
heal.
placenta, well, from what I understand, like the placenta detached from the inside of your uterus.
Yep.
I think there's a way they could see how much that's healed. I'm pretty sure that's what they're looking for, but they're just looking at tissue and making sure you're not at risk of an infection if you go have sex or go in a swimming pool.
Yeah.
Okay. What they're not looking at is anything to do with your muscles, your strength. I had patients come say like, oh, I asked my doctor to check me for diastasis and they told me that my internal exam was good and that, you know, I don't have it. And I'm like, I've heard that like multiple times. I even heard that from someone today. It doesn't make any sense to me. It's not their green light to go, you know, run, jump, have sex right away. You don't have to do that right away. You might not want to. And we could do a whole live about, you know, this topic separately, but it's not a green light to do any of those things. They're really just telling you you could start gradually making your way back to doing these things. Okay.
Yeah.
Don't start it, but you could work towards it now.
Totally. I love that. Yeah. Amazing. I think, yeah, there's definitely this misconception like, oh, 6 weeks, I'm cleared. I'm ready to go. I'm going back to normal. And I think that only contributes to this stigma around, oh, the postpartum period is just 6 weeks. Like, no, it's not. And
before your postpartum checkup, you go, we were talking about this before, like you go to the doctor for your baby like 5 times.
Your baby has been,
your baby was checked on 5 times.
3, maybe 4 times at that point, like at least. And you go 6 weeks, the first 6 weeks postpartum.
And then they're like, bye, see you when you have another
bye. And also the visit, and I'm not saying this like, it's just the reality it's a short visit. So it's not gonna be like, how's it going? I'm sure there are like really great providers out there who,
they will discuss
more
time options with you.
Birth control. Okay. But that's not like, how are you doing? How are you feeling about your birth? Like, is your pelvic floor functional? Which is, I know you brought, that's like what you're saying when we spoke about that before this live. Like, they're just checking, did it heal? And that isn't a really important step. Are you healed from a physical tissue?
But you're not healed. You're not healed. You're just doing well. Like, you're feeling okay.
Can you start now, like, progressing and rehabilitating, which is a much longer process, which is what you've been saying.
So I'm finding that OB/GYNs these days are a little more like knowledgeable. Like, I'll get referrals from doctors saying, okay, your scar tissue is like not looking good. Like, you're, you know, you might have pain with intercourse with this amount of scar tissue that you have. And that's something that's like really easy for us to treat.
Amazing.
So, you know, I'm finding now the doctors are a little bit more educated.
Right. Okay. That's really good. That's good to hear. And if someone feels like their OB is not referring them to a pelvic floor PT, something you can proactively ask for.
You can also run the other way and find your doctor, honestly.
I think it's like, whatever, it's a whole separate conversation, but it's not always like within their training. So unless they've like gone out of their way to learn about it, they might not know, and it's not, malicious or whatever. It's just whatever in their scope, but they're doing what's in their scope of practice.
It's a lack of awareness.
Yeah, for sure. And if you feel like you need more support, don't take the green light as like, well, I feel like I need more support, but my OB said I'm fine, so I guess I'm fine. Like, no, go to someone like Millie or a pelvic floor PT in your area, because again, you deserve to have a strong body and feel good in your body. And if you feel like something is off, there are other providers with different areas of expertise that can work with you, for sure. Okay, let's take one more question because we're pretty much at the hour. OBs just want to make sure your uterus is contracting back into place. They don't know much about diastasis. Exactly.
Yeah, okay. That's true.
Okay. Someone said, had my baby February 18th. So I was like a week and a half ago. I'm extremely emotional and the pain from the C-section is unbearable. When will I feel better all around? Okay. So in terms of the emotional aspect, the first 2 weeks postpartum, 2 to 3 weeks postpartum, like the baby, you have like a free pass. That's how I like to say it. It's called the baby blues. Emotionally, it can be up and down, and that's considered within the realm of normal. If something goes past that point, past that 2 to maybe 3 week point, and you're still feeling like emotionally you can't, like, not like yourself, it's interrupting your day-to-day life, you're either having, anxiety that is keeping you up even when the baby is sleeping, feeling like something bad is going to happen to your baby. So that could be like postpartum anxiety. There's also postpartum depression, which I know people are more familiar with.
And OCD as well, very common.
Right. Yeah, and there's postpartum OCD, postpartum depression, not enjoying life as you normally would, having, in an extreme sense, having thoughts of hurting yourself or your baby. And then postpartum OCD, there's also PTSD. So all of those, like the first couple of weeks postpartum, it's okay to be extremely emotional. But if you feel like these things are continuing past that couple week mark, then I would definitely encourage this person and anyone else listening to seek the support of a mental health therapist. You really do deserve to enjoy this time. And if you feel like you're not, there is support out there. In terms of the C-section part, so I hear a lot from mothers that I know who gave birth via cesarean that the first 2 weeks are the hardest. That's what everyone. That's what I've heard.
It's a huge surgery. It's a major
surgery, and so I think giving yourself the time to heal, and those first 2 weeks tend to be the hardest. I will also say though, if your incision isn't healing, or if there's pus or there's a foul smell, if you have any concerns, then you should always call your provider and get checked out, because there are complications that can come up. And if it's excruciating and the pain's not going away, even with pain meds, and it's not getting better, then I would certainly encourage this person to reach out to their OB. So it's a good question. Yeah, we do not need to suffer. Okay, you don't have
to be a martyr.
Yeah, you don't need to be a martyr. Like the postpartum period, yeah, it's hard. Yes, you're recovering, whether you gave birth vaginally or whether you gave birth via cesarean, which, as Millie accurately brought up, is a major surgery. And it's the only surgery that I'm aware of where you're like expected to care for a helpless person after.
So let's just when you think about it.
Let's just acknowledge that for a second.
That's where the village comes into play. You need a village.
Yes. So no matter what type of birth someone's having, you need a village. You need support. You deserve to have support, whether it's, physical, like the services that Millie offers, emotional, like a new mom support group, or even just like friends that are going through this with you.
Oh, wow, that question was from one of my patients. Hi. I'm just checking.
Like having friends that you can text or in your WhatsApp group, like, oh my gosh, this is happening to me. Like I was showering and my breast just started leaking breast milk everywhere, or I don't know, weird stuff. My newborn just did this and it's so weird. And people just being like, yeah, you're normal. Me too. Could be so validating. So I think we're just going to wrap up here. Millie, thank you so much
Thanks for having me. This was so much fun.
Great conversation. I'm sure there's like lots and lots and lots to talk about. If anyone wants to connect with either of us, our handles are at Birth Positive and at Millie DPT. And this live will be saved as long as Instagram cooperates, which it has been. So fingers crossed. Yeah. And Millie, is there anything else you wanted to add before we close?
I'm just like happy that if you saw this and got to this point, I'm happy for you that you know that if you need anything postpartum, there is help available.
Totally.
Lauren is incredible. She does birth classes with the husbands, which I think is phenomenal. I was telling my colleague about that today, like the husbands are involved. And yeah, postpartum is hard, but it doesn't have to be something that you suffer through. So there is help to get through this time period where you're taking care of a new person, your whole life is changing in front of your eyes, and yeah, congrats, you just had a baby.
Exactly. And it all takes time. So all right, thank you so much. Thanks everyone for joining, and have a good night.
Yes.
All right, thanks. Take care.
Bye. Shalom.
Yeah, good job. Bye.